This is Grant and Jasmine from Method Dental. Now you may wonder why we're both sitting in the kids area. Well, today we're doing a Q&A video on kids' teeth, why they're so important, how best to look after them, and what really goes on when you bring your kids to visit the dentist.
Yep.
The most common question we get asked, why are baby teeth so important? I mean, if they're just going to fall off anyway, why do we have to bother caring for them?
Yep, really common question. I guess right off the bat, baby teeth are important for a few reasons. They do all the things that adult teeth do. You know, they help you smile and talk, chew your food, all of those things. They're placeholders. So for the adult teeth to come through into the right spot, you've got the baby teeth to help guide them. And kids, they fall over a lot. They take some knocks and bumps. And I think I'd much rather have a baby tooth get a little bit damaged than have an adult tooth get damaged, although that does still happen to some poor, unfortunate kids.
So if baby teeth are considered placeholders, what's the problem if they get tooth decay, or if they need a treatment, or if it needed to be removed early? What is that a problem?
Yeah, well, as placeholders, you want them there till a certain amount of time until the adult tooth is going to come through. If they are lost early, the adult teeth might come in funny angles and might increase the risk that the child will need orthodontics or braces. But more than that, no one really wants to suffer tooth decay. Dentistry has come a long way in making dental treatment pain-free. But still, we don't wish anyone actually gets any fillings. So if we can avoid the need to ever have a filling for their entire life, that's the goal. But if we do get tooth decay and it gets bad enough, then they may end up with a toothache or infection, and they may not be able to eat properly or concentrate at school. But in the really severe cases, they can actually end up in hospital needing treatment. So put under general anaesthetic and having teeth removed or whatever. It's really quite sad and can be quite scary as well.
So that sounds really bad, and it's a lot more common than we think, isn't it?
Yeah, it is really, really common, tooth decay in kids. So the best research, it's out of the University of Adelaide, and they do a big survey around Australia. And they found that in 2010, children aged 6, over 50% of children aged 6 suffered tooth decay in their baby teeth. And it's not just about the baby teeth, but you're more likely to get tooth decay in your adult teeth if you suffered it in your baby teeth. So in children aged 9 to 14, over 1/3 of them suffer tooth decay in their adult teeth. So it is much more common than we think. Those numbers, to put them in perspective, asthma is the most common general health problem, and only around 11% of children actually suffer from asthma. So it's way more common than you think.
So it's definitely a more serious problem than we all tend to believe.
Correct.
So in light of all this information, what can we do about it? What are the recommendations? At what age should we bring our kids to the dentist for the first time?
Yeah, that's a great question. We get that one really commonly as well. And there is a little bit of a difference of opinion here sometimes, but I tend to stick with the Australian Dental Association recommendations, and they're in line with the Academy of Pediatric Dentistry in America as well. And that's to bring your child to the dentist for the first time by the age of 1, or within 6 months of their first baby tooth coming into their mouth. As for things that we can do to help prevent, say, tooth decay, I mean, there's just the general stuff. We've been through it a little bit in videos so far, and we'll continue to do that. But good oral hygiene, good balanced diet, and plenty of water to drink, and going to the dentist that you know and trust, getting the right advice, basically.
Excellent. So you did mention 1-year-old before. Some people might think that's a bit young to go to the dentist.
Sure.
What really happens when you bring a child of that age to the dentist?
Well, at 1-year-old, we don't expect too much participation.
Yeah, I can imagine.
But we do have to give them some credit. they absorb more information than we think. So what we generally do is we sit the parents down on the dental chair, the kid on top, we go for a ride, and try and just make it really fun, so they can get to learn their surroundings and whatnot. We provide general advice, those tips about oral hygiene and whatnot, and any questions that parents may have. We get it all the time. Just the other week, my sister-in-law asked about a 10-month-old boy, so our nephew, and when she should start brushing his teeth. He's got a few teeth now, and a soft head, small head, one of the infant toothbrushes. They're great, and you just start brushing with that. No toothpaste or anything.
To break that biofilm.
To break the biofilm from a previous video. General advice, specific advice, and just generally introducing them and setting the tone for the future. There's a concept in dentistry called the dental home, and it's something that's not really gotten out into the world just yet, but finding a place where you can trust the dentist and the child can grow to trust the dentist.
Which is so important.
It's so important because we see it all the time about these people. I don't know if you've met them. When I introduce myself as a dentist, and well, every other dentist does get this, is that people will then say how scared they are.
All
so
the
many
time.
people like that, isn't there? So we really hate dental phobia. It's such a terrible thing to have. It always leads to worse oral health.
Yeah, for sure.
So at Method Dental, we really want to try and breed a new generation of children that don't grow up fearing a
100%.
dentist.
So a first visit sounds like a lot of fun. But a lot of people might have hesitations on, paying for just a ride on the chair.
Sure.
What can you tell us about it?
Fair enough. Everyone has a budget. With fees for children under 3, at Method Dental we've taken the decision that we won't be charging any fees for this type of preventative visit where you can find your dental home. So we're just so passionate about preventing dental phobia, and that's the path that we're going to take.
Excellent. So we've spoken about toddlers, 1, 2 years old. What about, say, kids 4, 5 or 6-year-old, or even 10 or 14 years old? What should a dentist's visit look like for them?
Well, we find that as kids get a bit older, they participate more. So I find a lot of 3-year-olds, we can get a thorough examination done. Their teeth, their gums, their bite, how their teeth come together. Once they're 4 or 5, we find quite often they may start needing professional cleaning as well. And as they get older, like school age, they can understand a bit more information.
For sure.
So we like to go through how to brush properly. We use these little pink tablets, they're called plaque disclosing tablets. They stain your teeth pink and then you can brush it off. And that some kids learn better on models though, so we try and tailor that. And once they're a bit older, more like teenagers type thing, they understand a bit more about the relationship of diet and general health, and we can start to bring in diet and oral health and that how that all comes together. So basically, what happens with your adult visits at the dentist, but just for kids. Thorough examination, potentially cleaning, preventative treatment, fluoride and things, and the all-important advice.
So we've spoken a lot about kids' teeth and whatnot. Do you like to treat children?
If we didn't love to see kids here, we probably wouldn't be talking about it so much. Kids are awesome. They're learning, they're hilarious, they say the funniest things sometimes. Not all children are easy. Some of them don't cooperate the best, and that could be challenging. But with our philosophy of prevention, our awesome team, and fun visits, we really hope to change a generation so that no one grows up with a fear of the dentist.
100%.
And everything that we do here then at Method Dental is guided by that goal.
Exactly. So I hope you found this video useful. I've certainly learned a lot, and I hope you have too. If you have any questions or comments, obviously leave it in the section down below.
And if you're a parent, a grandparent, auntie and uncle, please share this video so we can get this message out about baby teeth and tooth decay.
Thanks for watching, and we'll see you in the next Q&A. Bye!
Bye.